All right, good morning, everyone. This is Phil Pugh, Director of Emergency Management and Healthcare Coalition Chair. We're going to go ahead and get started with our monthly meeting. Um, just a quick reminder for those who are not EDAP certified and want to improve their ability to respond to pediatric emergencies. EDAP is a great program. So hospitals, if you need to, please join the EDAP program. If you have any questions, please reach out to myself or Greg Atterbury. We'll start with a quick roll call here with our hospitals. Anderson Hospital. How about Alton Memorial? Boyd.
Nancy here.
Morning, Nancy. Carlinville Area Hospital.
James Kelly here.
Gotcha, James. If Eric isn't here from Anderson, I don't think we have anyone on from Staunton, but just checking for Staunton.
I'm here for both, Phil. I just got on.
Oh, gotcha. Thanks, Eric. I appreciate it. Over to Fayette. I think I see Tina on. Tina, you there?
I'm here, Phil.
Gotcha. Thank you. Gateway Regional.
I got Rick and Danielle.
Gotcha, Rick and Danielle. To our HSHS partners, start with Holy Family.
Cindy's here for Holy Family.
Gotcha, Cindy. And Aaron Rogers, I just got you for Alton. Oh, where are we at? St. E's.
Hi, Phil. Dawn's here.
Gotcha, Don. Thank you. Down to St. Joseph Breeze.
Hi, good morning. This is Margie Berry here.
Gotcha, Marty. And Highland. Okay, Jersey. And I'd be a bit remiss. Last month, I'll pause here just for a quick second, just to say I didn't get an opportunity to say thanks to Kelly out there at Jersey. He's been a great partner for the region. He has moved on from his position there. So to the good folks out at Jersey, thank you for allowing him to partake and being actively involved in the coalition. I'm sure we'll run across him again in some of his future endeavors, but thanks for all of Kelly's work. So Kelly Birdsong, great member of the coalition. For Memorial Hospital, Belleville, and Shiloh, you got myself. My team is in class this morning, so Mike Gilbert, Lee French, and Eric Perham. And I don't know if Scott's on. I can't see the entire group, so I'll just call out Scott. Are you on by chance?
Yes, sir. I'm Mac from Scott Air Force Base Clinic here.
Sorry, I was referring to Scott Edwards, but I was referring to Scott Klosterman. But we're gonna get to you here in a second. So, thank you.
Sorry.
Nope, no worries, no worries. How about Memorial Chester? No Georgia this morning. She took off. What? Who authorized that? OSF St. Anthony's.
Gary's here.
Gotcha, Gary. Thanks. Redbud. How about Sparta?
Yeah, this is Dale Worthington's on today.
Gotcha, Dale. Thank you. And Touche. See Amy on. Okay, over to our health departments, Bond County. Calhoun County. Clinton County. Eastside Health.
Eastside Health District present.
Gotcha, Charmaine. Thank you. Fayette.
Kendra's here.
Gotcha, Kendra. Thank you. Green.
Green's here.
Who was that speaking?
Molly Peters.
Gotcha, Molly. Thank you. Gotta let everybody know who it is. Everybody doesn't know everybody's voices sometimes. So, where are we at? Oh, we're at Green or Jersey. Where'd I leave off at? Sorry.
That was Green.
Gotcha, Green. Jersey. McCoupin.
Derek here, Phil.
Gotcha, Derek. Thank you. Madison County.
Michelle's here.
Gotcha, Michelle. Thank you. Monroe County.
Vicky here.
Gotcha, Vicky. Randolph County. And St. Clair County. I know Sam is on. Gotcha, Sam.
This is Kara from
I'm
St.
sorry,
Clair.
Kara, St. Clair County. I'm still
That's
stuck in
Kara
that
now.
loop. I know. I'm sorry. Sorry, Kara. Thank you, Kara. I see you on as well. I'm about to get
You're
over
here.
to our EMA partners, and Sam, I know you're here. So my apologies. Our RMSC, Greg, are you on?
I'm here, Phil, and Beth is on a PIO call, I think, right now, so she is not.
Gotcha. Thank you. Any of our BJC partners on?
Hey, Phil, it's Sean Eisenhower with BJC Emergency Preparedness.
Gotcha, Sean. Thank you very much. Our EMA, any EMA partners other than Sam? How about MedStar Ambulance this morning? None. Anyone from Abbott? Okay. SLU. I don't know if Helen is in town. All right. Now Scott Air Force Base.
Still here.
All right. Would you being newly appointed?
Hello, my name is Johnny Mack. I am an emergency manager and I work at the Scott Air Force Base Clinic in the Medical Readiness Department. So we primarily do emergencies and deployment of our members.
Gotcha. Thank you. I don't know if Tim is on today. I talked to Tim yesterday.
Yeah, look, we got intermittent issues, so I'm in and out, but I'm listening.
Gotcha, Tim. Thank you. And any of our STARS partners? No. Deborah, I see your hands up. Did you have something? If not, I will lower your hand just so I don't get confused. But Deborah, if you have anything, please shout it out. All right. We're going to go ahead and move on. Small agenda for today, which is good, so everybody get a lot of time back to their day. But a few important notes we'll go through that you probably saw on some of those slides. But we'll start off with our standard agenda items, starting with IDPH. Greg?
Good morning, everybody. Just a few things that I wanted to bring up for Beth and I. The hospitals, the ER staff need to be contacting the LHDs, the local LHD, if any questions or suspected patients with possible monkeypox come through. There's still a lot of calls going to immediately to IEMA from the ED department, and that causes a delay as they try to filter that through when the instruction is going to be to contact the local health department. So in addition to that, if the hospitals can make sure their ED staff know that they should be contacting the local health department, the local health department should be making sure that the hospital EDs have their 24-hour contact number. And that's just so we can get the information as soon as possible, because you're picking up, you know, when you call IEMA and you're getting somebody who answers the phone, and then it has to be filtered through, and it just takes longer. So if that information could get out there, that would be great. Our report came back from EM Resource this past month. Once again, quite a number of hospitals are having poor reports. I did do some detective work, and it does seem like a number of our hospitals are doing it incorrectly. I know we talked about having a training. It really is something that can be taught in about 5 minutes. I know we're missing some hospitals today, so I don't know if today would be the easiest way to show how that's supposed to happen. To be updated, we may want to wait till the next one and maybe get some word out if some other people want to join, but that's kind of up to Phil. Were you planning something yourself? Because I could easily demonstrate it too at some point for training on how EM resource needs to be done.
I think probably we were looking at trying to do it for the quarterly one because it normally has a little higher attendance, even though we got 29 here today, 40 or plus.
Okay, let's plan on doing it quarterly then. That sounds good.
Perfect.
And maybe you could get the hospitals could get the word out if somebody wants to listen in on that. Maybe we could do it at the beginning of the meeting so they wouldn't have to stay on and just demonstrate it. The other thing is I have two questions for two people. Tina, I know you're on. I did not hear anything about yesterday's weather affecting Fayette County. I know there was quite a bit of flooding over toward the eastern side. Were there any effects to Tina area?
No, Greg, we're fine.
Great. And then the other question, I didn't know if Charmaine or Sam might want to update us. I know there's a lot of stuff going in the East St. Louis area regarding the flooding. I've heard something about maybe a mark getting set up. Was there any updates you guys wanted to share from a health department standpoint?
So this is Sam. I can certainly give you a flood update from the EMA perspective. I will leave the health department side to Charmaine. But we did bring in some extra pumps. There was some low-lying areas in East St. Louis that was hit pretty hard. That water has since been pumped out and removed. Now we are starting on the recovery process, which unfortunately is going to be quite extensive and take some time. If anybody does receive any calls for, which direction they should go and how they should start, the first step is to make a report to United Way, which is 211. They also have a 1-800 number. For some reason, the 211 number is not working from some cell phones. I'm assuming it's a provider issue, so I can put the 1-800 number in the chat. But stress that is the first step, because what that does is then allow groups like Salvation Army and Red Cross that have resources, specifically cleaning supplies, to reach out to those individuals and kind of help with what their needs might be.
Thank you. Charmaine, is there anything you can add if you're still on?
Just to add to that, for the most part, we've just been receiving calls about helping the larvicide in the area. We have worked with our local agencies to try to help them out with the flood cleanup. We also distributed a lot of paperwork yesterday about how to handle cleanup for the flood and who to call if you need help to our residents.
Great. That's good information to know, at least if someone comes into the hospitals and speak about issues in the ED, that they can know that they can reach back out to the health department to seek some assistance. And Phil, that's all I have. Thanks, everybody.
Hey, Greg, this is Kara with St. Clair County. You mentioned the mark, and it's going to be at East St. Louis High School this weekend, Saturday from 9 a.m. to 7 p.m. and Sunday noon to 5.
Great. I'm sure that will help a lot of people in that area.
They said there was 42 homes with major damage, 43 homes with minor damage. 33 homes were listed as affected but didn't meet criteria for minor damage, and 11 homes were still inaccessible as of yesterday.
Rain's not fun, that's for sure.
Indeed. Any additional questions for Greg? lots of good work going on here in St. Clair County regarding the flooding. Was someone about to ask a question or talk? Did hear open mic? No? Okay. So great work, guys. If you guys need any additional, I know I'll talk a little bit for on Remert's behalf on what they did during some of the flooding. But if you guys need any additional support or anything, please feel free to reach out. Okay. So public health departments, I know Beth's not on, so I'll just pause here. So if any of the counties had any announcements that they'd like to make now, this would be a great opportunity. So everybody don't shout out at once, but any health departments with any announcements? Okay, hearing none. Okay, we'll move on. Any of our STARS coalition members join since roll call? Anyone from STARS? No STARS updates. Okay. So Remert, on behalf of Mike, I know he's out at training this morning. So I just wanted to relay that we did have a few responses, as you probably saw here with one of the local nursing homes here. And the team at Remert did an outstanding job working with the local fire jurisdiction. There was a lot of folks to move around. I don't know the current status of where we're at now with that same nursing home, but it was approximately 83, 84 residents that had to be relocated, and floodwaters were pretty much right up to the close to the building. I don't believe it finally breached it, but if anybody had any updates on that, that would be great. But the team went out with, the mutual aid response, St. Clair Special Emergency Services, along with our folks from Remert who fall under St. Clair Special Emergency Services. Anyone with any additional updates on that response?
Phil, it's Sam. I just know that the residents have been reassigned to, I believe it is 3 other facilities. Obviously, that's going to take quite a while for cleanup to happen. It's not going to be something that's going to happen quickly, but yeah, shout out to everyone involved. I believe the time frame was 1 hour and 35 minutes, and several other skilled nursing facilities in the area sent their, I believe, medical transport buses to help with transport. So it was a great team effort across the board, and to have all of that completed in 1 hour and 35 minutes is pretty amazing. So they did a great job.
Indeed. We also did establish a D4H incident or channel to help facilitate some communication during that response. While we didn't use it a ton because it was very rapid in what did occur, we did get some positive feedback from some folks who were sharing information there. So as always, a reminder, if you're a coalition member and you don't have a D4H, it's our common operating picture account, and you're a hospital, local health department, any EMAs in our region, and EMS personnel, agencies, please give me a call, shoot me an email, or Lee an email, and we'll make sure that you're situated. Very easy system to use, and it does just help facilitate communication during those instances. All right. Decon training. Well, I'll pause and say we do have decon training next week. I think it's on the 11th. Is that right? Yep. The 11th. That class is completely full. I think there's 19 or 20 folks signed up, scheduled for that class. So if you're scheduled, or you have some folks scheduled in your organization, please make sure that they have completed all the prerequisites as listed on the course description, and we'll get them trained and get them back to you. So we are working with our BJC within our healthcare system and the folks in the St. Louis Area Coalition on trying to expand their decon training. So more to come on that, but doing a lot of work behind the scenes to try to help other organizations, not in our coalition directly, but just adjacent to us, try to expand what they're doing at their hospitals. So more to come on that. And I think the next decon training is not that we have on the books is not until late October, I think October 26th, if I'm not mistaken. Those courses can be found inside of Member Planet. So please make sure your folks are signing up through Member Planet. All right, grant status. So on 7/6, we did submit our budget on time as requested and by IDPH. Immediately that day, I put together this memo that you see. A lot of you didn't get a copy of this memo, I'm sure, but this is kind of a snapshot of it, requesting the immediate review and approval of our work plan and associated training events that are tied to our budget, so we can kind of start training as quickly as possible. For those of you who've been in the coalition for a while, you are very used to, over the past 4 to 5 years, us having concurrent grants running over. At one point in time, we had 3 concurrent grants running at the exact same time. It's very difficult to manage effectively, and it costs us to lose out on a lot of training. Now, a lot of training and or equipment and supplies. And it's not for lack of trying, but sometimes the bureaucracy of just government takes time, and sometimes that time is needed, and folks need to be able to review information and make sure we're able to spend. Sometimes it's a little overbearing, and quite honestly, we've lost out on plenty of years. I think some of you lost out on funds just because you weren't able to execute those funds in a timely manner. So with purpose, we went out to seek approval from IDPH to begin spending money earlier than normal. Normally, we're really waiting outside of things that must be paid, things that we have standing contracts for. We had to wait for work plan approval and budget approval and have a fully executed grant to spend those funds. And that could be late winter. And when I say that, that's normally January, February timeframe, and all the way out to April in the past before we've had a fully signed and executed grant. So IDPH has, heard our cries, listened, and basically approved our coalition, and there will be probably more that will move forward to begin spending money on training initiatives. I specifically asked for training because that's something that we can't, if we have 10 classes we want to do outside of decon classes that we want to bring in specialty training for, and I get a budget approved in April, that means the end of April, May, and June is all the time I have to execute those classes. And again, we've lost out on classes because the calendar year gets squished into 4, maybe if we're lucky, 5 months. So 8/1, we did receive approval to move forward with scheduling of trainings in our work plan, and IDPH is pushing forward to put out a memo, basically an addendum to the grant, which will allow for, I'm going to call pre-spending. You can kind of see some of the language there in that email, but they'll begin to put out they'll begin to allow us to start to spend and recoup those or get reimbursed properly as an allocable expense, which is the key word there. So that's great for us. And if you can kind of remember from last month, this is just kind of a copy of last month's slide. These were all the courses. We had $125K set aside for training and education in accordance with our TEPW, our training exercise planning workshop, now the IPPW, the integrated planning and preparedness workshop. But those are the courses that we have outlined. And what we will try to do is get them scheduled as soon as possible. And we're going to be targeting early fall. So if we can, we may have courses starting as early as September if we can get them started. So when my team gets back here, we're going to begin the hard work and diligent work of getting these scheduled. If you would like to host one of these courses, you see the courses that are there. You may think it's beneficial for your organization, and sometimes you just can't get people to travel, or maybe you have a system policy that says due to COVID or whatever reason that they're limiting travel. I know I'm in that situation here with the BJC system with certain things. So that's understandable, but maybe you could host a training. This is our opportunity to do that. So please reach out because we don't want to host everything here at Memorial. We want to be fair to the region, and we want to, try to reduce the travel time for certain folks because I know a lot of times it's very difficult from someone from maybe Fayette to drive all the way out here for an all-day training. It becomes a big event. Sometimes it's a little easier, but we want to be as fair as possible. We want to give you guys an opportunity to host a training as well. Some of these may end up being virtual. Nonetheless, we're gonna have them, and I think the region will be better off for it. So this is a win for us, and we're gonna get started on it immediately. Does anyone have any questions with regard to the current grant? And it's the FY23 grant or anything with regard to training? Tina, go ahead.
So question, if we was help host a training and education, like I think looking for room size or something, or depending if it's virtual or whatever, I guess part of mine for my organization is how many that would be in attendance to decide if we're able to do that or not.
Indeed, and it would be great if you were just interested and you told us what's your maximum. That'd probably be the best, and we can tell you what we could do because some of these are up to 30 people, and some are actually limited to maybe like 15. So if you're interested in hosting, just let Lee and I or Eric, whoever know here or send it to info@SWILHOPE because that reaches all of us, or rhcc@swilhope.org. That reaches all of us. You can always email us through those and just let us know what you can do. I know we've hosted a lot of things. Good folks over at Gateway, St. E's, Anderson. Folks have been very willing to do this in the past, and we want to continue that trend because we don't want to seem as though we're trying to just push everybody to come here. So thanks for asking, Tina. Sean, I see your hand up. Sorry.
Yeah, Phil, I apologize. I had some technical difficulty and I lost connection after the East St. Louis flooding. And then you were asking about STARS members joining. So I did have a question for public health in reference to the screening documentation. Hang on just a minute. I've got it. Nice. Wanted to clarify, are the health departments utilizing a standard criteria screening form and consent forms for vaccination? Or is there an IDPH standard that's been shared with all the counties with Karen, Michelle, and their teams?
There has not been, I'm sorry, this is Kara with St. Clair County. There has not been anything sent from us to us from IDPH as far as a standard screening form. We have sent the screening form to all of our hospital partners. Are you talking about the vaccination screening or just as far as testing?
Specifically around the vaccination.
Okay, yes, I have a copy of that. It's been sent out to all of our partners that have access to the vaccine. If you want it specifically, I can send it to you. It's just one that it was modeled around Chicago's, the one that they were using. So it checks all the boxes. So that's the one that we have and we've sent out to our partners.
Yeah, I would appreciate that. I'll put my email in the link, Kara. And then finally, is public health, are you holding the vaccine, or if a request comes in, then do you have to submit that to IDPH to get vaccine sent to you?
We received vaccine and we distributed it throughout the county. So it's positioned throughout the county, in different areas. If we need more, we can certainly request more. But at this time, we haven't burned through our allotment.
Thanks, Kara. Sorry about that, Phil. Technical difficulties. I missed the public health update.
I'll look for your email. Thanks.
Thank you.
No worries. Great information there. Thank you, Kara, and thanks, Sean. Any other questions regarding grant, training, etc.?
Phil, this is Nancy. I have a question.
Yes, ma'am.
Could you maybe send us all something that explains like what DICO basic course is, or, you know, just a little blurb about what we would be getting if we chose to, you know, host a training session?
Of course, yep, we will do that. We'll put together a one sheet that will have a link to each one of those, you know, brief description, the cost, and how many we're targeting, you know, the size of the class that we're targeting, and a link to each one of those courses. We'll definitely do that, and that way you can kind of review it and see which one's best suited for you guys. Thanks for that question.
Thank you.
Mm-hmm. Thought I
And
heard
Phil,
Go ahead.
you'll send that to all of us, because
Yep.
I had a couple questions on those too, so it'd be great.
Yep, we'll send it out to the entire region. I think we already have a spreadsheet with it, but we'll try to make sure it's clean enough and real legible and easy to navigate, so everybody can kind of have a fair shot at it. Okay. Just a reminder of the 2022, and it's actually the FY23 review, but we're looking to approve those plans on September 7th. That's our next meeting. So, you know, we have to officially approve the plans and the governance documents every year. So if you had changes, remember, you can download all the copies of those plans by following that link. It doesn't require any passwords or anything like that. It should be open to everyone. Download those copies, and if you need, and you can forward all of a copy of the comment review matrix and any changes that you wanted to see in that comment review matrix over to info@swillhope.org. Please send us those so we can have them again, because we're looking to approve these as early as we can in the calendar year, because this is what we will be basically holding ourselves to. And as a reminder, the two most recent plans were the burn surge annex and the radiation annex, and we are currently working on the next year's, which will be the chemical one, the chemical annex. And the goal with that, just to give you kind of a preview, is that we're going to turn that into a full CBRN annex. So it'll be chemical, biological, radiological, nuclear, and potentially high yield explosives. We may include the E in the CBRN acronym there. But we're going to make it more of a one-stop shop instead of having, 3, 4, 5 specific annexes. That way, because what I know will happen is then there'll be a biological terrorism annex or something that goes along with that next. So we'll just cover all our bases at once and pull from what we have currently. So any questions? Sound like I felt a hot mic there. No? All right, so open floor. Any questions, concerns, issues that you guys have noticed or want to bring up before our quarterly meeting next month? Go ahead, Tina.
So I just wanted to briefly talk about the Starcom radio a week or so ago. And Greg, correct me if I'm wrong or anything, but our Starcom radio, we wasn't able to hear communication, or no one heard us. So we had our radio contract come in to review it, and that they found out that our tower and everything is working. And then Greg or Danley or both gave me the name of Mr. Cochran, who was awesome, who did call, and he says he monitors towers every day to see if there's a tower issue. Him and I was able to do a telephone call. He was able to get it up and running. I hope yesterday that we was able to hear for roll call, or they heard us. But Motorola has no parts to repair the Starcom 21, is my understanding. And in speaking with Mr. Cochran, not sure if this will fix the Starcom issue, but just seeing if anybody else has had any problems with their Starcom.
Tina, we did have last week, we did experience some issues with our Starcom radio here and our weekly tests that we do with all the hospitals and Scott Air Force Base and a few other folks around here. So we did experience some issues, but seem to have been rectified since. So I don't know if there was, for us, I don't know if there was something going on with the towers or what have you, but we've had several radio checks and communication since then. Matter of fact, I did participate in the EMA or the IEMA's test was that yesterday. So, and everything seemed to be working fine. So I don't know if that was intermittent. And my, or probably pretty much our region's communications officer is not in today, but I will relay what you've said and see if he's heard anything at all. I don't know of anything else, Greg. I don't know if you know of anything else or if anybody else on the line.
Well, I heard yesterday that the Jacksonville area had some at their repeater. I see you, John. Hang on. I saw he did reach out to me. He apparently monitored ours and asked us if we had issues. And I told him I did not know because I was not on Tuesday's call. So if you did have specific issues, Phil, were they just some people weren't able to be reached? I can let him know about those issues.
Yeah, it was very intermittent. It was pretty bad, to be quite honest, but it seems to rectify. John, what'd you have? I know you had something.
As far as the Starcom, last week during the roll call, that was also right at the dead middle of all the radio traffic that was going on over the flooding. I can tell you just from my end, on what I'm allowed to watch from the Starcom analyzing dashboard, that the system was just being completely overwhelmed. And of course, you know, we were hitting off of a lot of the St. Louis towers that happened to be up for Starcom, but there was just a lot of traffic, a lot of users on the radio all at the same time. I don't know if anybody has put out a report about that or not yet from Starcom, but I do know because we had a couple small issues ourselves, you know, just getting that busy signal when we don't normally get a busy signal, are not being able to quite copy or getting that digital, what I call digital static. But there was a lot of traffic. The system was extremely bogged down. Every county had issues. Every police department had issues. So everybody that was on there was trying to talk on a radio system at the same time. So I know that created some of the problems.
Yeah, in hindsight, yeah, you're right, John, as far as the timing of all that. So it was crazy that I didn't hear a lot of traffic, but everything wasn't on EMSR4. That doesn't mean that, you know, those trunks weren't being saturated. So definitely could have been maybe overused. So I am curious to see what we find out as far as the usage and, you know, do we hit peak usage or what have you? So, all right. Anyone else with any other items? Hearing none.
Bill, I just have one other question for hospital other EMS, or if there's, I don't believe there's anybody from mental health on, but I'm just kind of curious if they've noticed any difference or any complications with the new federal push out with the 988. I know I have some questions that I want to keep for our quarterly meeting. Hopefully we have some folks from mental health, you know, Chestnut, somebody, because we do know that system is up and running, but my understanding from other meetings that I'm being involved in, a lot of our stuff is transferring to the Missouri sites. And then they're being told to call 911. So I'm just curious if there's been any type, or if any of the hospitals have noticed anything different, or been getting the phone calls. But you know that I think that was July 15th. I could be wrong on the date, but I know it hasn't been that long that the 988 hotline for mental health has been activated. And I just curious if anybody has heard anything from that.
Yeah, I think it was either the 16th or the 20th. I'm sorry. I'm trying to go back and look now. Yeah, it was July 16th when it was established, and then I think on the 20th it was available. So I haven't had any feedback yet, but that's a great question, and I'm taking a note to bring that up for the next meeting. I do think that you know our social workers and I don't know about our EMDs at the PSAPs and other locations if they're receiving any of that information right now, but I know it's early on. So I did see Tina's hand. Oh, go ahead, Greg. Tina will come right to you
A
next.
little bit to it. So the state is working with ISP and the mental health at DHHS and all of that. They have already had initial meetings that have been set up. There was an initial meeting with the EMS medical directors. I have been asked to be on the EMD portion of this requirement of working with police, EMS, and the 988 calls. I have not had the first meeting with that yet. I do know that they've also reached out to Dr. Schaefer as the chair of our EMS advisory committee. And they are gathering names in our region that I believe will include mental health, social workers, hospital, EMD, the EMS, that kind of thing. So yes, it is being worked on. It is starting to come together. I have heard a potential have everything completed by the end of the year as to how all of this will work. So there is much more, I'm sure, to follow, but it is being addressed at the state level and soon should start to get addressed at the regional level.
Hey, Greg, it's John. Just on that, I'm glad to hear that there is some movement. Do you know, are there any call centers actually in Illinois that are up and established yet?
I do not know of any. I can certainly check that out. Has there been, because from what I understand, they're using existing call centers that, are you talking call centers to the 988 or call centers to EMD? You're talking about
Correct.
988, right?
988 are supposed to be separate call centers, from my understanding, from what I've read.
I do not know. I hope maybe by our next meeting, I will have more information. Like I said, I've not had the first one scheduled. I just received an email probably about 6 days ago that said I was being put on that committee so that they understood the EMS rules when it comes to EMD and fielding these calls to the appropriate places. So I'm hoping we'll have our first meeting soon and I'll be able to share some more info.
Good, because you mentioned a magic word there, Greg, and I knew you probably would. The EMS rules. We have run into a couple of different incidents already where somehow or another caseworkers have been called out approximately the same time 911 has been activated. So again, does EMS have the authorization or not to, because once we've been called, we have a duty to act. And so what's happening is we're both showing up and it's like, whose patient is this? You know, do we get a refusal and let mental health or Chestnut take care of it? Or do we just stand back and then let Chestnut make a decision? But no matter what, the 911 was used. So we need to document something. And that's created a couple of problems for us.
Yeah, it is a problem. I'm sure it's going to be addressed. You know, everything happened so quickly. They passed the law, then 988, like literally, I think we found out a few days before that they were flipping the switch for the date that Phil had said. So, yeah, I think they're trying to race to meet it, but you know, you don't want to set up a system that's destined to fail. So I hope they do take enough time that everything is addressed. But like I said, more info to follow.
And Tina,
Thank you, sir. Phil, that's all I have.
No problem. Thanks, John. And thanks, Greg. Tina, I know you had your hand up.
Yes, the 988 was initiated. I know it didn't get initiated in our county until last week. I received a call, and what they're running into the problem is getting staffing for 24 hours. So currently it's Monday through Friday, 9 to 5. So if you're in crisis, I don't know that anybody can remember to call during those hours. But my understanding is when they get the call, they go through their call center as a separate line. Then they will, and I don't know what the response time is for them to get to this person. But when they get there, if they need 911, then they're supposed to activate that system as the way it's supposed to work for the county is what I'm understanding. But I haven't heard that they've actually had a call yet.
Okay. Thank you for sharing. I know more to come on this. This is going to be obviously something that we're still going to have to work through the wickets on. Hopefully, it's a full benefit for everyone involved, and we get those who need that type of care to the right spot, and we don't overtax, whether it's our EMS, fire, or police. So we'll just have to see how it works out. But definitely will be a topic for discussion at our quarterly. All right, as far as upcoming events, again, next coalition meeting, September 7th. The 2 decon training dates we talked about on the 11th and then the 26th. Make sure you go through member plan to sign up. The coalition plans and governance documents, again, we had put out that we'd like to, gives us an opportunity to make any final changes if you can get them to us by the 15th. So that way we can brief whatever changes there will be to those plans or adjustments. So please get those to us as soon as you can. Again, send them to either rhcc@swillhope.org or info@swillhope.org. The IAM is going on November 11th through 17th. We will have at least 2 members attending. Myself and Lee will be in attendance there. And then the National Healthcare Preparedness Coalition Conference. Eric Perham will be attending that. I may attend, if not, potentially maybe Scott Klossman will attend. Just got to work out a few things to see if I'll be able to attend that. Coalition proposal deadline is December 31st every year. And again, that's for 2024 because we submit our 2024 budgets and work plan in spring of 2023. So I know we're only in 2022, but you got to have some good forward thinking there. And IDPH Summit, and Greg, I don't know if you've heard at all, but still to be determined if that is going to occur. And again, we got a long time between now and then, so I'm sure they haven't made any decisions one way or the other yet. So
no decisions.
Yep, got it.
Phil,
All right.
it's Sam.
Yes, ma'am.
I forwarded you.
Planning for it.
Uh-oh. Two folks at once. Sorry, Sam. Stand by. What you say, Greg?
Oh, I'm sorry. I was just saying that they are intending to have it next year, but there is no definitive on that. I think they're waiting for the fall winter surge to see if it happens.
Got it. Got it. Okay. And Sam, I know you had something.
Oh, yeah, I forwarded you an email about Cameo training that's coming to O'Fallon in September. I don't remember if I had sent it to you previously, but if you wouldn't mind shooting it out to the coalition.
Okay.
It's September
remember
20th through the 22nd, and it's going to be at O'Fallon Fire and EMS headquarters. It's free, and it's a pretty good training. So thank you.
Yep, no worries. I got it right here, and I'll forward that out. All right. Well, it's 10:51 on a Wednesday afternoon. We're almost at the peak of the week, so hopefully it's all downhill after noon today. So thanks for everybody for joining. We're going to end it here, and we'll see you next month. Recording will be uploaded here this afternoon to YouTube. If you need to go back and take any other notes. Take care, everyone.